our today's both learned faculties, chairperson of the today's program, Dr. Hiren Mehta, other dignitaries and the office bearers and other attendee doctors. Good afternoon and warm welcome to all of you in the 5th scientific webinar of the College of General Practitioners after completion of the 4 successful webinars. As of you all know very well that we have decided to arrange one webinar every month, particularly on the subject pertaining to the family practice. And today this is the 5th one on the menopause and the andropause by 2 learned speakers. Next month there will be the festival, but we have planned. We have also planned one webinar on the GI bleeding. Tentatively, the subject will be GI bleeding, upper GI bleeding, and lower GI bleeding. The date will be announced depending on the festival days and the availability of the faculties. All of you know very well that we have also applied for the credit hours, so it will be granted. You have to apply under the link given below this at the lower level of the page. After this introduction, I would like to invite Dr. Hiren Bhai as a chairperson. He will introduce and welcome all the faculties. Thank you so much.
Good afternoon, participants, dear friends, and our speakers. It is my honor to introduce our first speaker, Dr. Deepak Bhagde, sir. He is very senior most gynecologist. He passed his MD DGO with gold medal in 1981 from Ahmedabad. He was past HOD of Gynec Department, MP Shah Medical College, Jamnagar. Scientific Committee Chairman, Gujarat State Gynecologist Organization. He was President of Jamnagar Gynec Society, President of Jamnagar IMA, member of Board of Studies, Saurashtra University. He delivered oration at SOGOG conference at Rajkot, 2014. He is in private practice since 1985, so he is having very vast experience in gynecology and obstetric department. He has conducted more than 60,000 deliveries. My God, too high score, sir. Since 1985, including high-risk obstetrics, in addition to routine gynec and lab work. And last but not the least, he will be awarded IMA Lifetime Achievement Award next week during IMA conference. Congratulations, everyone, sir.
Thank you.
I welcome, sir, and invite you to the dealer topic on menopause. Is it really a pause? Let us explore. Welcome, sir. Thank you.
Thank you, Dr. Hiren Bhai, Dr. Dhiren Bhai, Dr. Jaswant Bhai, for making me a part of this very successful web series which you have started. I'll try to share my screen. Is the screen visible now? Is the screen visible?
Yes.
Yes.
Yeah. Okay.
Visible.
Fine. Thank you. You already introduced me. Really would like to thank IMA Gujarat, Dr. Darbar and Vijay Popat for coordinating with me for this wonderful seminar. How do we define menopause? 12 months of amenorrhea. This is a retrospective diagnosis. Depletion of ovarian follicles, which we cannot see, but mainly I would say anything, 12 months of amenorrhea means menopause. You really don't require any other test for that. What is a menopause? It's the normal change in woman's life when a period stops. That's why some people call menopause the change of life or the change. Yes, some women do not like to be called menopause, so we always say a second part, puberty part 2. Yes, we would also, respect the ladies' thing about that. We really won't say menopausal woman. We would say, no, she's a elderly lady or something like that. Diagnosis, as I said, just 12 months. But yes, if you really want to go, history is the main thing. And I would only do serum FSH. Why you really want to do all these things? Once she has not bled for 12 months, we'll call it a menopause. No, these things are important. You know, when in some very young girls, unfortunate girls, around the age of even 25, 26, even earlier, there is a premature ovarian failure. And even at that unfortunate age, they start and they have the menopause, which is really unfortunate because they are never going to conceive and they will have absolute menopause. So these are the girls which you would like to test. And if you see serum FSH high, or easily if you can give a progesterone, and then you can see if she does not withdraw by progesterone only. With estrogen, progesterone, they might withdraw because there is an estrogen. The uterus is primed with estrogen, so they might withdraw. So the best diagnosis, I will say, only one test, serum FSH, should be enough for these unfortunate girls who are in this thing. So what is premenopause? Some years, 3 to 5 years before menopause. Perimenopause is 3 to 5 years, and menopause transition is say anything around 45 to 47 when they are transiting from premenopause into menopause. Post-menopause, you are already worried. It's a span of time dating from final menstrual period, regardless of whether menopause was spontaneous or iatrogenic. This iatrogenic is when you do oophorectomy while doing a hysterectomy. Nowadays, even if the lady is 45 years old still, ovaries are really, really, really helpful. If you really need to do a hysterectomy, please try to preserve the ovaries. At least they will work for some time. So that is the main part. Premature menopause, as I said, is a spontaneous menopause occurring between two standards. So I would say, you know, when there's a premature menopause is less than 38 to 40 years, I would really call it as a premenopause. Early and delayed menopause, early is anything between before 40, delayed is anything after 53 or 54. Basically, in India, the women get menopause around 46.4 years. In the Western countries, this is around 52 years. What is an induced or temporary measure? Induced menopause is a cessation of menstrual that follows bilateral oophorectomy, as I said, or iatrogenic ablation of ovary. You know, sometimes in a patient of breast cancer, there are some incidences where, because of the progesterone, estrogen from the ovaries, we try to stop them working. So these are the induced menopause. Temporary, sometimes, very, very rarely. I've never seen a girl, you know, that there is an ovarian failure, and sometimes this ovarian failure sometimes cures by itself, but this is very rare. This is the main thing. Why we want to talk about menopause? One, even as a gynecologist, I would not say, you know, we never care about, frankly, to ask a woman, especially the Indian woman, you know, we feel that they are all okay, there shouldn't be a problem at all, and they have taken accepted. No, it's not that. If you ask them direct questions, they would tell you a lots of things where what they are suffering from. And this is the time, in fact, even at your level, you know, you should always feel, you know, કે બેન કઈ તકલીફ ખરેખર છે, મેનોપોઝ તમારા માસિક નથી આવતું તો તમને બીજી કોઈ તકલીફ થાય છે. You know, sometimes we really need to have the direct questions to them. Then and then probably they might come out in privacy. And this I personally feel is very important. Yes, we gynecologists also sometimes are guilty of not really taking care of menopausal. That's why, you know, there are special menopausal clinics now where they really take care of menopause. And Indian Menopause Society is taking a really active part, which I'm an active member also. I was the past president of IMS also in Rajkot branch. And we try to see that we try to help the menopause woman. We'll go to menopause. So age at natural menopause is 46, as I said. And later on, for that is a different thing altogether. Why do we really care for menopause? Is vasomotor symptoms is the main thing, hot flushes. Fortunately, somehow our Indian ladies don't get that much, but it is not a rarity, let me tell you. sometimes say કરશે કે સાહેબ બહુ જ એટલે બહુ જ ગરમી પડે છે, શું કરવું? So you have to really take care of these vasometers. Musculoskeletal, they probably will see that we give some extra calcium. Uro-Gynecologically, where they feel there's a dryness in the vaginal part. Metabolic, sometimes Alzheimer and associated maladies. Now, here I would like to really say the other symptoms can be treated by some drugs like calcium, some vitamins, but vasomotor in the urogynecological. These are the two, hot flushes, dry vagina. These are the two which you really have to take care of by a gynecologist. As you said, the 7 drafts of menopause, itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. They are really not psychos. I mean, because they are really, really in pain and you feel they are psycho. Is this menopause? Can I get pregnant? So this is another thing, as soon as, even if she is 45, 46, she'll come to you as soon as there is an amenorrhea. You really have to assure them, બેન આ તો થશે, 3-6 મહિને પણ પીરિયડ્સ આવશે, વર્ષે આવશે અને ગ્રેજ્યુઅલી જતું રહેશે. પણ you might have to really reassure them by doing a sonography, a pregnancy test, or whatever it is. So whatever the investigations, these are the all investigations which are really normal, which you do it for everyone. But I will stress only for one thing here, pap smear. And at your level, I'm sure you can really target that. Okay, as soon as she crosses about 30, 35, let them do a pap smear at least every 3 years. This is a must. Why? Because we can really prevent CA cervix or CA body uterus, or CA body uterus means carcinoma of endometrium or cervix, at least 3 to 4 years before she really has it. Especially if she has a history of CA cancer, CA cervix in the family. Mammography is another thing, especially with the history of breast cancer in the. So these are the main thing I would really say. Eye test, and that is all fine because these are the routine things which you go for a general checkup at every 3 or 4 years. Why you want to really know this is a menopause? It is reported that osteoporotic fractures occur 10 to 20 years earlier in India compared to Caucasian. The first myocardial infarction attacks occur 4 to 4% Asian women at a younger age than European women. In India, type 2 diabetes occurs a decade earlier than the Caucasians. Breast cancer incidence peaks before the age of 50 years. And cervical cancer is the leading cause of mortality due to cancers in women. So that's why I said the pap smear, we got to really take it. See, there is an Indian tradition also. The ladies make sure that the husbands have milk and they probably don't have milk. Who does really require milk for calcium? The ladies or the gents? You tell me. Why are the tradition so far that no? In fact, I will tell you my own example. Even my wife will not drink the milk I have tested. I don't know why. She says, no, this is for you only. So these are some of the traditions which are real to come out and try to help our women in at least getting calcium and vitamin D after the menopause. This is the least we can do for our ladies. Primary prevention like a lifestyle modification, diet, calcium and vitamin D. They really require a good diet. The green vegetables which we have abundance, we are lucky. In the sense that our fresh vegetables don't cost as much as they cost you in the European countries. And what are the symptoms? And whether these symptoms can be prevented by counseling, some drugs, or whether she would require a hormone therapy. Personally, if you ask me, if they really require hormone therapy, there was a big trial of WHI, and they really say that menopause has no role for hormone therapy. No, this is a biggest disservice if I say was WHI research, and they said the hormone should not be given, and it was given so much of a publicity. The only thing is that those ladies were almost about 70 years. Yes, I wouldn't give hormone therapy to a girl who is 70 years. But anything before 59 years, I would certainly think, yes, of course, you take the precautions. But these are the ladies where you really have to give hormone therapy. And nowadays, the indications will come. What are we going to prevent? Overweight, metabolic syndrome, diabetes is the main thing, CHD, osteoporosis, cancers, lead sequelae, and as I said, treat urogenital atrophy. Basically, as soon as the woman gets into 45 or 50, most of us, including, as I said, gynecologists, they feel the sex is not part of their life now. Is it really true? I would say no, no, and no. Why at the age of 45 or 50, a lady, I would say a young lady should stop sex? The husbands are already ready. So we got to really treat them, suppose if they got a urogenital atrophy. And this is where the hormones will surely come. Mainly the lifestyle changes, avoidance of smoking and alcohol. And another thing, nowadays, the research says, yes, in India, the number of males have decreased in smoking, but the percentage of ladies smoking has increased. Isn't it bad or whatever you say? Yes, overall, the smoking incidents, the smoking people have decreased in our country, fortunately. But unfortunately, there are more women smokers in percentage than the males now. We will try with the non-hormonal treatment first before we really go to the hormones. So suppose if you see how much and what you really would like to give to your menopausal woman. Cereals, as I said, pulses are very important. Because pulses are important in the sense that you require proteins. How do you really build up proteins? And here you require animal source of proteins. And unfortunately or fortunately for us in Gujarat, the only animal source of proteins what we have is the milk, cheese, butter, ghee. And ghee, now, if you go to the recent literature, they will say, please give some ghee. Don't be afraid of ghee. And don't be afraid of ghee and the adverse effects of the cholesterol. No. Yes, if you ask me, I will say stop sugar, limit yourself to salt, but at least have a spoon of ghee daily. That is not an issue now, because ghee, this is a dilemma in the sense the ghee will prevent cancer, but ghee will make sure that your arteries get clogged. It is really not that. So everything in moderation, including ghee, vegetables, fruits, sugar. I would say you really got to stop at an early age also. I mean, the earlier you stop sugar from anything, including your tea or milk or whatever it is always better. So these are some of the dietary source of phytoestrogen. When if you see, basically, it is a green source of vegetables, the color fruits, like say capsicums, which are green, red, yellow, carrots, which are oranges. So I always say, suppose if my patient is a pregnant, I always tell her, the fairness or white always is beautiful in a lady. But suppose if you really want to maintain your health, છોકરી 100% રૂપાળી અને ધોળી સારી લાગે. પણ ખાવાનું જેટલું પણ ધોળું છે, બટર, ચીઝ, ઘી is all bad. Sugar, salt. So avoid fruits, avoid food which is white in color, but have more of greens, have more of colored fruits. See, basically, if you see how our Indian standards have given us turmeric, garlic. Now, especially with our pregnancy vomiting, what we are doing is giving them in a garlic in a tablet form. The Europeans, the other researchers have found that the garlic is a beautiful source of prevention of and they have started putting along with the doxylamine or other antibiotic drugs and putting garlic also. So, see, turmeric is not costing us much. Ginger is good. Beetroot, vegetables. These are fantastic food for anyone, in fact. Phytoestrogen, as I said, the color fruits. Mainly here is the fermented fruit like idli and dosas. They have phytoestrogens which will prevent you having some of the menopausal symptoms. This is very important. Calcium. As I've been saying, the Indian women require more milk, than male, especially in a vegetarian diet, because they don't have any other source of calcium. So adult woman, menopausal woman requires at least 800 milligrams. She might get some from the calcium. She might get some calcium from the green vegetables she's having. But you really got to supplement her with at least 500 milligrams of calcium daily once she attains, or even when she crosses around 40. Calcium is a very important source, and this will prevent osteoporosis in the fractures. Exercise, any age, is important. Whatever you say, muscle mass you have to develop. And once you start aging, I don't think you are going to do aerobics and all those kind of things. You might not do it. But personally, if you ask me, walking is the best exercise you can get. You'll build up your muscles. When you are walking, you can move your upper limbs also. And a walking of 30 minutes a day would really help you. Because if you see, 60% of our nerve endings are in the muscles of the feet. So if you try to lose those muscles and those nerve endings, you are not going to walk after some times. So walking is very important. It will help you to build up your muscles, which is important because the muscle mass, as you are getting elderly, is going to go down. As I said, aerobic exercise, whatever I will say, basically forget this weightlifting and everything. We really don't do it. But suppose, even if you can do walking and some yoga, if it suits you, is a great. But basically, I would really put my thing only. Walking is one thing which you can do easily. You don't have to really do any other, go out of the way to do all this. And while you are walking, you can always move your arms also. It's never too late. Weight bearing, strength training, flexibility, mainly back straightening, balance, breathing, and brain exercises. Stretching exercise, if you can do it. If you can do this, that's fine. Otherwise, as I said, walking and some stretching like this should be enough. Now we'll come to what are the main menopausal symptoms: hot flushes, night sweats. Lifestyle options are always there, loose cotton clothings and all that. But some of this women surely will require hormone therapy. We'll come to hormone therapy, which we can help them out. Loose cotton clothing, warm drinks use, alcohol, caffeine, smoking is the worst. A good diet will help you. Most women with menopause symptoms will experience cessation of hot flushes within a year or two. So this is just 1 or 2 years where you really got to give. And here, suppose if she's really having a bad hot flashes, you've tried every alternative medicine, I would not hesitate to give them hormone therapy. Some estrogen, add some estrogen, and last 10 to 12 days, add some progesterone also. So we don't have to worry about cancer of endometrium. But these are the ladies, this and the URO-Gynecologist. I would give estrogen only to 2. Earlier we used to give for prevention of heart attack, metabolic diseases, Alzheimer. No, these are not the indications. For us now, the only indications of giving hormone therapy, estrogen and progesterone, is for hot flushes and urogenital. And as I said earlier also, don't consider age of 45 or 50 that she's not going to have sex at that time. Respiratory things is always helpful. Before prescribing hormone therapy, maternal hormone therapy, dialogue, medical conditions, some breast examination, pap smear, and the lowest dose of estrogen you will start. Suppose if she has been hysterectomized, you don't need to give progesterone, you can give only estrogen. But you got to really follow up with pap smear and mammography every year. Continue for as long as, as short duration as possible. As I said, mainly the pelvic and the breast examination. The other tests are all normal, but pap smear and mammography. Before mammography, a clinical examination, a self-examination of breasts by the woman, somebody to really teach them, and that really will help you out. Estrogen, as I said, estrogen and progesterone, Timolol and Raloxifene, but mainly it is the estrogen which can be helpful for these elderly ladies. Vaginal cream, vaginal estrogens are there. Suppose if you are giving only vaginal estrogen, you don't need to worry about the CA cancer and CA endometrium, because it's not going to absorb that much to ovaries. These are the first thing you can always try. But suppose if she is not happy with only a cream, I would not really stop me doing from giving them the oral estrogen also. Vaginal dryness, yes, of course you try the lotions and everything. Lubricants you try, but suppose if this does not really help them, I see once the dry part and the dryness in the vulval region and the vagina, I mean, that will really differ them, and it's going to be really painful for them. So you really got to help these ladies. Non-hormonal, as I said, is the bit of psychological, some hormones, some drugs like vitamin D, B complex, moisturizers, lubricants. Communications about that's why I said, some women notice that they are experiencing vaginal dryness at the time of life. Are you experiencing discomfort with sexual activity? This is the direct question you really got to put to our patients. Our patients are not that normal. They are not that much, because they really feel ashamed. But if you put this at least as a gynecologist, I think this is my primary duty. And probably if you're even with you people, when you are doing all the type of practices, this is the one question where you can even ask someone that whether you require some help in this part. Psychological, not really. It's more of menopause. Yes, you get it, but it is mainly the hot sweats and the urogenital which follows will help. Here it is mainly the drugs and the counseling which should really help them. Broken bones is the most important. See, femur, neck femur, if you break in a lady, you can understand whether she's going to be bedridden. And after a neck femur, I'm sure my orthopedic friends and my medical friends and all my other friends, other doctor friends will say, after neck femur fracture, because of the prolonged bed rest, the mortality, it's not a mortality, but quite a lot of patients, so it's more than 10% die just because they are immobile and all that. So prevention of the fractures is very important. As I said, calcium and the vitamin D should be given to all menopausal women. Lifestyle modification, of course, statins. So estrogen may have protective role in CLD prevention in women up to 50 to 59, but this is not the main indication that you should give estrogen. I would give only for two indications, as I say, the hot flushes and the urogenital. Hypertension, diabetes has to be treated. Lifestyle, obesity is bad. So suppose if you really decide to use hormones, use them at the lowest dose that helps. Also use them for the shortest time you will need them. See, basically, when you are staying in a joint family like ours with an Indian tradition, how happy they are with some water. And look at the girl here, Plumi. So Indian families are happy. They take the menopause very simply, and the time passes with the children, the grandchildren. Same thing here, the grandmother and the grandchildren, not the grumpiness. So happy family, and with the children and the grandchildren, certainly is their lifestyle. Look how happy she is to cook for her husbands. She might be a menopausal, but because she is happy, you don't take estrogen is a big issue. Exercise is another thing. Negative mind will never give you a positive life. Thank you very much. Thank you for the kind.
Hiren.
Thank you very much, sir. Thank you very much for such a nice and precise information in very short time.
Yeah, it was a difficult topic to finish in time, but anyway, I thought I'll just give some of the things where we can really clear up the things.
That's what I told, very short and sweet with all information precisely told. Thank you, sir.
Thank you. Thank you. Thank you.
Okay.
I'll stop this. Yeah, that's it.
Yes.
No, this was.
Hello. Now it is time for our second speaker. I would like to introduce our second speaker of the day, Dr. Darshan Shah, very senior urologist, consulting, practicing at Apollo Hospital and KD Hospital, Ahmedabad. He is fellow of American Urological Society. He done his 2 years fellowship at Long Island Jewish Medical Center, New York. And most important, he is author of 7 international papers and 4 chapters in international textbook. His area of interest are vaginal reconstruction surgeries, fistula repairs, and urology. I would like to welcome and invite Dr. Darshan Shah sir for the topic Andropause, understanding the male midlife transition. Dr. Darshan Shah sir.
Good evening.
Good evening, sir.
Can you share my screen? Can you see my screen?
Yes,
Yeah.
we can see.
First of all, thank you, Bhagde Sahib, Deepak Bhai, Saras, Mana, enlighten karwa mate. Menopause, I am a urologist and always kind of managing testosterone. First time I am listening something about
No,
estrogen.
but yeah, when you are operating as a urogynec surgeon, I'm sure you require estrogens also there.
Correct.
Yeah.
So today my topic is andropause, and thank you for asking me to present this. It refreshed my knowledge as well on the very interesting topic. So andropause is a natural hormonal transition in men, often referred to as a male menopause. Age-related hormonal changes in the men are different from that one in the women. We will explore its various aspects and shed light on the impact of symptoms and management of this important stage in the life of man. Why can't I change my slide? Do I need to do something to
No,
change?
you are what are you using? iPad or a
It's my laptop.
this one? Acha, okay.
Rahul, can you help?
F5. Is it not a slideshow?
Yeah, it's a slideshow.
Okay, down arrow or the enter. There is a down arrow in your
Yeah,
laptop.
down. It's not coming.
Down arrow.
Trying to do down arrow and trying to enter.
Enter. Try to save enter.
Rahul, can you help?
Yes. હા ફરીથી કરો.
અને સ્લાઇડ શો માં મૂકો દર્શનભાઈ.
હા. એક જ મિનિટ હું બધું બંધ કરીને પાછું ચાલુ કરું.
હા, તમે છે ને stop slide sharing for the first time and then try it again.
ઓકે.
ના આ સ્લાઇડમાં તમે ટ્રાય કરી જુઓ ને સ્લાઇડ શો.
ના નથી થતું મારે.
હેંગ થઈ ગયું.
હા પીપીટી છે આ તો. બધા જ બટન. હું એક વખત ફરીવાર બંધ કરીને ચાલુ કરું. Oh, now it's done. ધીમે થયું પાછું.
ઓકે.
ઓકે.
શું હતું ક્યાં પ્રોબ્લેમ હતો?
દુખી એ કોમ્પ્યુટર ધીમું છે.
હા, ઓકે.
So, andropause refers to the gradual decline in the testosterone level in aging men. Typically, it occurs around the age of 40 to 50. Hormonal changes are natural part of aging. Unlike the more dramatic reproductive hormone plunge that occurs in women during menopause, however, sex hormone changes in the men occurs gradually, very slowly. This decrease in the hormone production can lead to various physiological, psychological changes which affects overall life, well-being, and quality of life. In women, ovulation ends and the hormone production goes down during the relatively very short period of time. This is known as menopause. In men, production of testosterone and other hormone declines over the period of many years, and the consequences are not necessarily very clear. This gradual decline in the testosterone level is called late onset hypogonadism or age related low testosterone level. A man's testosterone level decline on an average of about 1% a year after the age of 40. But most older men still have testosterone level within normal limits. Only 10 to 25% have levels which are very low. However, as a man age, not only does the body starts making less testosterone, but also the level of other hormones called sex hormone binding globulin, which pulls the testosterone in the circulation. The level of sex hormone binding globulin increases. So most of the testosterone, free testosterone in the circulation will get bound to the sex hormone binding globulin, and there are very less free testosterone available for the tissues which are using it for routine day-to-day activity. Low testosterone level in older men often goes unnoticed because they don't have much symptoms. Testosterone level can be checked by blood tests, but tests are not routinely done. And many men who have low testosterone levels experience no symptoms at all. In addition, the signs and symptoms associated with low testosterone are not specific of that one of low testosterone levels. They can also be caused by person's age, medication use, and other conditions such as high BMI, and they still have no major signs and symptoms suggestive of low testosterone. But there are few such symptoms which I would like to bring you to your notice. Symptoms such as reduction in the sexual desire and activity, decreased spontaneous erection and erectile dysfunction, breast discomfort and swelling, infertility, bone demineralization, and sometimes men also they have height loss, not the weight loss. Men also experience symptoms such as hot flashes and excessive sweating. Other problem and other possible symptoms include decreased energy, motivation, confidence, and depressed mood and poor concentration. It is also possible to experience increased sleepiness, sleep disturbances, unexplained anemia, reduced muscle bulk, strength, and increase in the body fat. So physical changes associated with the andropause include reduction in the bone density, increased risk of osteoporosis, reduced body strength, and decreased overall energy level. These changes can significantly impact the individual's physical capability and overall health. Psychological impact of andropause. Psychological changes associated with the hormonal fluctuation in andropause can lead to emotional instability, irritability, anxiety, and depression. Recognizing and addressing this psychological impact is essential for promoting holistic well-being during this transitional phase of the man's life. Common health risks linked to andropause. Men experiencing andropause are at an increased risk of developing various health conditions such as cardiovascular disease, diabetes, metabolic syndrome. Understanding this risk is crucial for implementing and preventing measures in this lifestyle modification. Diagnostic method for andropause. Diagnostic method for andropause typically involves assessing the hormone level through blood test and evaluation of symptoms. So we do blood test as well as we try to evaluate the symptoms. This test help in confirming the presence of hormonal imbalance and guiding the appropriate treatment approach. Normal serum testosterone levels are 400 to 1000 nanogram per deciliter. Urology guidelines suggest that doctors should use total testosterone level less than 300 nanogram per deciliter as a cutoff in support of the diagnosis of low testosterone level. Experts recommend only testing older men with low testosterone if they have signs and symptoms. If an initial test result shows low testosterone, then test should be repeated to confirm the result. Ideally, the serum testosterone level is done early in the morning because early in the testosterone have diurnal variations. So early in the morning, testosterone levels are maximum. If the initial testosterone test is low, then we must confirm it by repeating the test. And to determine the whether it is actually low or not. And if the testosterone levels are low, then we must test the other hormones secreting from the pituitary gland to recommend to find out whether is there any other deficiency or not. High risk group: patient with unexplained anemia, height loss, low bone density, newly diagnosed type 2 diabetes, patients on chemotherapy, patients having exposure to testicular radiation, HIV patients, and patients on chronic narcotic use or maybe on steroid. These patients fall in the high risk group and have very low testosterone levels, and level must be checked when even in absence of any signs and symptoms in above mentioned groups. So what are the treatment options for patients or men with andropause? Treatment options for andropause include hormone replacement therapy, lifestyle modification, and dietary changes. Lifestyle changes to manage andropause symptoms. Implementing healthy lifestyle changes such as regular exercise, balanced diet, and stress management and quality sleep can significantly reduce the andropause symptom and improve overall well-being. Importance of exercise in andropause management. Regular exercise, including strength training, cardiovascular workout, not only helps maintain the muscle mass and bone density, but also enhances the mood, cognitive function, and overall vitality during the andropause. As Sir rightly said, that a diet rich in nutrition such as vitamin, minerals, and essential fatty acids can help reduce the andropause symptoms. So in summary, therapeutic lifestyle changes we usually prescribe to our patient that they should do regular isometric exercises, aerobic exercises, at least 150 minutes per week. Weight loss should aim at the BMI less than 25. And one of the very important thing is to improve sleep hygiene, regular bedtime hours, and at least 7 hours of sleep every night. What is the role of testosterone replacement therapy in managing andropause? Testosterone replacement therapy is a common medical intervention for managing andropause symptoms. Recommendation on the testosterone therapy for men with age-related low testosterone vary. Endocrine Society suggests that one should only give testosterone replacement with patients having signs and symptoms, any signs and symptoms. While physician and urologist suggest that one should give hormonal replacement, testosterone replacement to the patient with the sexual dysfunction only, not all the symptoms. Patients with sexual dysfunction and who needs some support, some treatment to cure the sexual dysfunction needs hormonal treatment. because there are side effects of testosterone replacement. So for men on testosterone therapy, usually they have most of the men, they have quite relief of their bothersome signs and symptoms. But for others, sometimes the benefits are not that clear and there are possible risks of testosterone supplementation. Potential risk and benefits of testosterone replacement therapy. Though further research is needed, testosterone therapy might stimulate the growth of metastatic prostate cancer and breast cancer. Testosterone therapy may increase the risk of heart attack, stroke, and possibly increase the chances of deep vein thrombosis. So what are the alternative therapies to supplement and support the signs and symptoms of menopause? Some alternative therapies that have been suggested for managing symptoms of andropause include herbal supplements, acupuncture, diet and exercise, and stress reduction technique such as meditation, yoga, and mindful living, which potentially elevate some symptoms of andropause. We always prioritize a comprehensive discussion with our patients and ask them that they are not proven therapy, but we may use this for long-term symptom-free period. So, most important aspect of andropause, the sexual dysfunction or sexual health. Andropause can affect sexual health, leading to decreased libido, erectile dysfunction, and changes in the sexual function. Treating sexual health issue during the andropause typically involves comprehensive approach, which may include both medical and psychological interventions. Some common treatment and strategies are hormonal replacement therapy. HRT involves use of testosterone replacement to help address symptoms like reduced libido, erectile dysfunction, and overall sexual health issues associated with the andropause. However, the use of HRT should be carefully monitored and one should keep the testosterone levels between 450 nanogram per deciliter to 900 nanogram per deciliter to avoid any major side effects. Medications for erectile dysfunctions in andropausal men. One can use this PDE5 inhibitors such as sildenafil, tadalafil, but as these old age patients, they have associated diabetes, cardiovascular problems. Sometimes they are on nitrates, so one should consult their doctor before using PDE5 inhibitors. Counseling and psychotherapy is required to reduce the performance anxiety in this phase of the man's life. Lifestyle changes over and above the healthy lifestyle, healthy diet. One should avoid smoking and excessive alcohol consumption to improve sexual health. So what is the importance of regular medical health check during the andropause? Regular health check during the andropause are crucial for monitoring and maintaining the overall well-being. Some key reasons for regular health check includes monitoring hormonal levels, early detection of the health issues such as cardiovascular disease, osteoporosis, and diabetes, screening of the prostate health, particularly in andropausal men, regular prostate examination, the digital rectal examination, PSA testing will definitely find out early detection of cancer prostate. So by prioritizing regular health checkup, individual can take proactive steps to maintain their health and well-being during the andropause and allowing for early intervention and effective management of any potential health risk associated with the andropause. So to conclude, andropause is a natural stage in men's life characterized by hormonal changes and various physical and psychological symptoms. Effective management strategies, including lifestyle modification, medical intervention, and psychological support, can significantly improve the quality of life during this transitional phase. Thank you.
Thank you very much, sir, for such a nice lecture on a very unorthodox topic.
Is there any question? Over to Smita Ben. Dr. Smita Ben, please.
Very nice information about the menopause and andropause, but I think the psychological therapies must be helpful.
Can I answer this?
Yes,
Please.
So basically, menopause and andropause, they are a normal physiology and psychological help because of the lot of information and lot of demand from the society. It is not only medical help. Always psychological help and medical help together will have the best long-term results. Medical help is only indicated for those patients who are symptomatic and who need something extra. Otherwise, only psychological help, a healthy lifestyle, holistic health is the best answer for this.
Darshan, if you can stop your sharing the things,
Yes.
then we can see all each other.
Let me stop.
Okay.
sir. So next question is, how long one can use this local application of this estrogen Evalon?
Anytime. And I mean, you can use it for as much as you like. There's no issue.
Because in our general practice, we have seen so many this older female patient having recurrent urethritis and itching and all that.
So even a short-term hormone therapy, even an oral therapy, just can will really help them out, especially with the urinary tract infection and the itching part. You can give it for, even if you can give some estrogen for 3-4 days or 5-7 days along with that, or estrogen cream should not be an issue at all. I would really recommend it.
Long time it is used advisable. Long time is used advisable. Evalon cream is.
See, basically, I think up to age of 59, I don't think there's an issue at all. See, mainly will require, basically mainly you try to go for, so it's between the age of 47 to 59. Until 59, even if you are giving a hormone therapy, the estrogen cream is absolutely safe even after that. There's no issue at all. You can use it.
Now,
in fact,
yes, sir.
Now, what I was saying is estrogen, I mean, it doesn't really require that much of follow-up also. The endometrium is not going to get hypertrophied with that small dose of estrogen in the cream.
Okay, fine. Now, two questions for Darshan bhai.
Yes.
One is, what should be the dose of this testosterone for this male andropause patient? And second thing, while for this ED, do we prescribe testosterone and this sildenafil tadalafil simultaneously, or we have to wait for the result of testosterone then prescribe?
Testosterone is available from different companies in different strength. The Cernos depot, which is like widely used, is like 1 gram depot. The locally available. There are other patches and there are creams available for testosterone, but easily available is Cernos depot, which is 1 gram that one should repeat every 1 monthly, but that should be repeated only after seeing testosterone levels. Testosterone after Cernos depot, one should make sure that after 1 month, the testosterone level should be between 450 to 900 nanogram per deciliter. If it is very high, then one should not repeat the testosterone depot. And yes, testosterone along with sildenafil do wonders. Usually we give testosterone along with sildenafil simultaneously for all those patients who are complaining of erectile dysfunction. And gradually we stopped giving testosterone and put them on SOS, sildenafil, or maybe tadalafil.
And so many this sort of patients are having comorbid condition, diabetes, hypertension, and everything. So, do we need an investigation before prescribing testosterone?
Absolutely. Those patients who are having erectile dysfunction. It is a very widely discussed topic. They have hidden cardiovascular problems. So before starting any therapy like testosterone or maybe sildenafil, one must make sure that a patient is not having any hidden cardiac issues. So one must investigate the patient cardiac wise and then only start this treatment for erectile dysfunction. All those patients who are diabetic, they must control their sugar levels by appropriate measured diet, exercise, and medication. And then only the efficacy of my treatment will be better.
Okay, Smita, what up? Thanks.
Oh,
Any question?
any question? Good afternoon, everyone. It gives me a pleasure to deliver the vote of thanks for this virtual webinar to all the dignitaries here. Let me first of all start by giving the glory to the God for making the today's webinar success. On behalf of IMA College of GP, Gujarat State Branch, I, Dr. Smita Shah, would like to thank our speaker, Dr. Deepak Sir, and Dr. Darshan Sir for sharing the knowledge with us. Very nice information about the menopause and andropause. A special words of appreciation goes out to our dedicated team. And also thanks GSB President Jadeja Sahib, Secretary Dr. Mehul Sir Sahib, and Director of College of GP Dr. Darbar Sahib. Lastly, we thanks to each and everyone to you present here. Thank you once again. Jai AMA, Jai Hind.
Thank you.
Okay, thank you, sir.
Bye.
Now we conclude this session.